Dr. Adam Harrison is a physician, lawyer, and leadership coach who brings a unique perspective to his varied services. His personal and professional experiences with workplace bullying fuel his mission to make leaders kinder and create psychologically safe workplaces for everyone. He joins us today from New Zealand. Adam, thank you so much for taking part in this conversation titled Navigating Workplace Bullying, Finding Resilience, and Feeling Joy Even in Crisis. How you doing, Adam?
Hey, hi, Andy. Thank you so much for inviting me along to your summit. I'm doing all right today, thank you. Sun is shining here in New Zealand. Sky is blue,
Looks
so
gorgeous.
no point in whinging. It's all good.
Okay, great. Well, against this beautiful background of yours, I have to ask you about some dark experiences that you've had, and obviously that your clients are having. So, amazing background. You're a doctor and a lawyer, so we'll get into all of that. But despite your status and your accomplishments, you've been bullied at work multiple times and you've experienced burnout. Can you tell us a little bit about that, given your multiple degrees and your success in creating a wonderful profession for yourself?
Sure. Well, as you've alluded to, having a kind of a decent academic background is not in any way a shield from
Yep.
these experiences. And in fact, in some parts of the world, like Australia and New Zealand, if you are, an accomplished person or what some people, might perceive as an overachiever, that in itself can be a reason to be bullied. I'm sure you've heard of tall poppy syndrome, but it's very very rife down here in the Antipodes. But that didn't apply to me anyway.
Well, tell us about that real quick. What does that mean? What's that term mean?
Yes. So, the tall poppy is the poppy that grows above the other poppies. It's striving for the sunshine and being, arguably biologically superior to the other poppies. And the tall poppy kind of gets cut down.
Yeah.
That's the sort of analogy here. We people here, if you are striving and looking to better yourself and be better than other people in their perception or their narrative, then they want to sort of figuratively cut you down, bring you back down to size.
Yeah. In fact, I have a saying that I kind of like in exactly that vein, which is
Mm.
some people like to look taller by cutting off the heads of others.
Yeah, that's kind of it, really. But yeah, no, it's a real shame. I mean, I would never condone it. I can see why some people might feel like that if the taller poppies are not humble with
Yeah.
it.
Yeah.
I think
Yeah.
we just need to be kind and humble and help the other poppies grow up to our level as well.
So how did your bosses or more, the senior doctors, you tell us, how
Mm.
did the bullying manifest itself in your circumstance?
So, I mean, when I talk about types of workplace bullying, there's the sort of general types that are can occur in the workplace or occur elsewhere, and these can be overt, really really sort of obvious in your face, like the kind of classic schoolyard physical bullying. But there can be something that is potentially seen by other people, public criticism, shaming, berating, belittling, that kind of thing, ostracizing people. And then there's the sort of all the forms of discrimination and harassment. They're all really types of bullying. Discrimination on the grounds of your gender, your racial origin, your belief system, your sexuality, that kind of thing. And then there's the more covert types of bullying, those that aren't necessarily seen by other people. So it may be noticed by other people, but I think the passive aggression, gaslighting, these terms I don't particularly agree with, having spoken to lots of often African American friends and people who've been on my podcast, but casual racism. You
Yeah.
know, arguably there's nothing really casual about it. You know,
No.
if you're getting on a bus and you are electing not to sit next to a black person and you will walk past them to go and sit next to a white person or sit on your own, to me, there's nothing casual about that. It's very, very intentional, you know.
Sure.
Um,
So, if I may, but out of
mm,
all those litany of things that can happen to
mm,
you were a doctor, and I would think
yeah,
doctor status have. So how did
yeah.
it happen to you? In fact, I remember in researching your background before the interview, you had a quote of something to the effect of, as you were thinking about work over a weekend, you said to yourself, "What fresh hell would the perpetrators unleash on me when I was next at work?" So tell us a little bit about what happened there. Who was doing
Well,
it? And
yeah,
how did they do it?
yeah. No, no. Well, you know, as to the types, a lot of the workplace bullying in medicine, because it's, you know, administered, if you like, by n- not particularly emotionally intelligent people. Because let's, you know, if you think about this, this was for me, it was in the early to mid noughties, sort of between 2000 and 2010. Really, I graduated from med school in 2000. You know, that generation of senior doctor, they they didn't know much about emotional intelligence. You know, they didn't know how to regulate their tempers. You know, and they just, you know, they lost it in front of people on the wards. You know, so there would be like some of those overt forms of bullying I talked about. You know, where not I wasn't ever struck by anyone, but you know, I was absolutely publicly criticized, shamed, berated, belittled, you know? And you know, that would happen. That was just normal. It was just accepted as part of the culture that you know, you're just going to be put down and told off, you know, like a child really. But in the, you know, the severest possible way.
In terms of what the doctors were doing, they were berating you, they were humiliating you, you
Yeah.
felt shame. And how did
Yeah.
you deal with it? How did you respond to it? Did you just try to work harder?
The thing is when you as a doctor, you know, you're held to such a high degree of professionalism. You know, it's you know, in a way there's the hypocrisy of the system that these people who are treating you like this are almost allowed or sanctioned to behave in the most unprofessional of ways. But you as the target on the receiving end, you have to, you know, maintain your composure and you can't shout back at them. I mean, there are myriad reasons for that, including the fact that, you know, biting the hand that feeds you, you know, you're going to shout
Yeah.
back at someone who's responsible for writing you a reference, you know,
And
to
writing
get
your
your next
checks
job.
in a way, and signing the checks. I mean, maybe not literally, but
Yeah.
uh, those are the people, they have all the leverage. And I was in
Yeah.
television production and still
Yeah.
am, but for 25 years here in New York, and I loved the work. I'm sure you loved being in medicine. You worked so hard to get there, and you don't want to just let the bully win. At least in my case, I loved the work. I loved following the news and
Mm.
communicating the news to the world. And I thought I just need to, and to be gendered about it, I say this often, I don't mean it quite this way, but, you know, man up, right? Like I'm
Yeah.
supposed to be
Yeah.
tougher, but to your point, I didn't feel like I had the leverage to
No.
speak my mind because I thought that I'd lose my job, lose my
Yes.
income, which I needed, lose my job, which I had
Yeah.
worked so hard to get. So
Yeah.
I certainly understand that feeling. So what effect did
Yeah.
all this bullying have on you? Here you are. It's hard enough being a young doctor, but what effect did it have on your emotional, psychological, and physical well-being?
Yeah. So, I mean, you're absolutely right. There's a huge power imbalance,
Yeah.
and so you can't really react or respond to it. Um, in those days, as a junior doctor, you know, it just never even entered my mind, and I'm sure it's the same for my colleagues to raise a complaint about your boss, go to HR and tell them what had happened. You just wouldn't do that. And
Nope.
as I say, as a doctor, you're kind of you are from a professional perspective, put on a little bit of a pedestal. And
Yeah.
there's a certain amount of, not so much these days, a certain amount of deference towards you for, as you say, your academic achievements of getting through medical school and so on. And, you know, everything has to be perfect. I mean, medicine is full of perfectionists, and it's really drummed into you at medical school that you can't make any mistakes. You know, you can't show any weakness. You know, you can't
Yeah.
have an Achilles heel. You can't have a chink in your armor. So
Yeah.
you just have to sort of, you know, grin and bear it. Really, just take the tirade of abuse and just, you know, smile with grace, and
Yeah.
then go, you know, go off the ward as soon as they finished, as soon as it's safe to do so from a patient perspective, or whatever, and just cry
Yeah.
in your doctor's office or whatever, or go back to your accommodation and have a cry, or hold it all in, and because the day's so busy that you
Yeah.
wait until you get home and you just have, you know, cry about it then, and you can't really. I mean, I would speak to my family about it, but you can't really speak to your colleagues about it because, again, you know, they're all trying to maintain this front,
Yeah.
you know,
Yeah.
of perfectionism,
Well,
and you can't let them know that you have any weaknesses, you know. So,
yeah, when
um,
it happened to me, I was a boss myself. I mean, I was an
yeah,
executive
yeah,
producer,
yeah,
and I most often reported to either the CEO or the number two in the whole
yeah,
company or the network, the media
yeah,
company I was working for.
yeah,
And so one, I was trying to shield my staff from it, so I was absorbing all of it.
mm,
And I also didn't want anyone to know that it was getting to me. And so I'd go home, and you are alone. As much as I had a supportive family, for much of it, a very supportive wife, we've been married over 20 years, but you're still alone because nobody can help you if you're
yeah,
on
yeah,
that circumstance.
yeah,
So for me, I had digestive problems,
yeah,
terrible anxiety,
yeah,
hypervigilance. And I did have,
yeah,
and it's hard for me even to say it to this day, suicidal ideation. I was one that
yeah,
was going to act on it, but
yeah, yeah,
I was ruminating.
yeah.
Um, and did you experience some of those types of things?
So I think it's a bit like that, that adage. I think it's originally a sort of a Chinese adage, but the death by a thousand cuts, you
Yeah.
know? So
Yeah.
you just are constant. I mean, it was just, how can I say it? It's probably had more effect on me later on because, honestly, it was just the norm in the culture. It was just accepted,
Yeah. Same in
you
television.
know? Yeah, and you know, I mean, this is a bit of a British kind of pop culture reference, but there are these films from the 1950s and 1960s and later, I think, as well, called, the first one was called Doctor in the House, and they were with an actor called Leslie Phillips, and there was this, when they were medical students, there's a scene where they're around the bedside of a patient, and the consultant surgeon, who's like an absolute dinosaur, but he's also like a huge guy, absolutely huge
Yeah.
guy,
Yeah.
and his name is Sir Lancelot Spratt,
Okay.
right? And you know, if it wasn't so awful, it would be very very comedic, but it absolutely, you know, just abject humiliation of these students and these junior doctors, and that's just the way it was. You know, it's what we called teaching by ritual humiliation.
Yeah. Almost like
What it
in
was.
this country, I don't know if fraternity hazing on college
Yeah.
campuses. It's just
Yeah.
part of the
Yeah.
culture. And
Yeah.
so,
Yeah.
yeah, I mean, it's amazing that this can still go on. And we're talking about healthcare, which I
Yeah.
understand, and you're the expert. And I want to get into the work you're doing to help others because you've been through it. And now that's what you're doing in just wonderful ways. But you it happens in healthcare. I hear a lot education.
Yeah.
I talk to all kinds of people in
Mm.
nonprofits. You think
Yeah.
in nonprofits, people would be kind to one another, because their whole job is to help others, and yet they end up bullying each other. I mean, it
Yeah.
happens or television, media, you name it. But
Yeah.
you sent me an amazing video, and then we'll move on from beyond
Yeah.
medicine and doctors. But you sent me an amazing video. It was kind of a panel discussion with several
Yeah.
doctors
Yeah.
who were talking about their experience, as you have.
Yeah.
And the
Yeah.
first doctor was a young female doctor in this case. And as she was
Yeah.
talking about the effect of the bullying and the berating, and again, you acknowledge it. You said it before, and in my case too, nobody ever threw a stapler at my head. I'm not
Yeah.
gushing blood. I'm not a Me Too victim. So we understand this is the incivility in the workplace aggression,
Yeah. Yeah.
psychological harassment. But she burst into tears talking
Mm,
about it.
mm.
And
Yeah.
again, to your point, I don't think most people have any idea. We look at people like you and with status. And so let me ask this: you work with other doctors now in
Yeah.
counseling them, and then I'd
Yeah.
also like to hear about the other types of people. What kind of stories are you hearing from the people that are coming to you in your work?
So I think I just want to speak to your earlier point first, if that's okay, for a
Please.
wee bit of background.
Yep.
But I think for me, it was a cumulative effect. So I would just, as you said, kind of ruminate. I would go away and I would think about it and I would rationalize it and I would normalize it and just say, well, I'm dependent on this person to get my next job, so I just have to toe the party line and let them treat me how they want to. And there's this kind of delayed gratification. When I'm in my next job it'll be better, when I'm a more senior doctor it'll be better, and whatever. But actually, over the years of experiencing, in surgical jobs primarily, you know regular repeated forms of over bullying and just constant criticism. The thing you got to remember in medicine is that, and I work with doctors all over the world and it's the same all over, is that you very, very seldom get praised for doing a good job. It's never going to be, that was really good that you decided just to do those extra bloods because you picked up this, deteriorating renal function that actually means we can't prescribe that medication. You might have saved that person's life. Well done. Job well done. It's 99% just negative. So that is going to get to you. And for me, it was over the years where I started to, and I think the manifestation of it for me was with burnout. I think the workplace bullying
Yeah.
frequency of exposure led me to burnout, and there were other reasons for the burnout as well. Um, in terms of the things that other people say, absolutely. I mean, you've got from the sort of acute side things that you've described where people actually have suicidal thoughts, or get depressed. But the thing about doctors and depression and doctors and anxiety is they have what we call high functioning anxiety or high functioning depression. So they know all the signs and symptoms. They can hide it. And often what happens is, we're recording this on the 11th of September, and yesterday was World Suicide Prevention Day.
Mhm.
And 300 to 400 physicians die by suicide every year in the US alone.
Yeah. One of I
Right?
took
So that's
mention
one
that
a
he
day.
yeah, one of my best
Yeah.
friends of my whole life,
Yeah.
took his own life. He was in an emergency
Yeah.
room because
Yeah.
he couldn't let on that he was having real difficulty.
Yeah.
So I know
Yeah.
this is new and
That's
it
it.
hard. Yeah.
Yeah. So they hide it, they keep it in. And then the first you hear about it is, oh my goodness, the absolutely shocking news that you find out that a colleague has died by suicide. So that happens. Obviously, those that um don't get to that kind of awful level, that tragic level, will still have PTSD and flashbacks and kind of
Yeah.
chronic depression. And also, there's that mental health side of things for sure. But there's all the other kind of I don't want to call it, I don't like this term, kind of like the softer side of things, like just having your confidence knocked all of the time is going to reduce your self-esteem. It's going to lead to imposter phenomenon. You're going to
Yeah.
not be an assertive person in the workplace. You're going to be conflict averse.
Yeah.
All of these things that actually will hold you back in your career
Yeah.
are manifestations of it as well.
Well, in my world, I was in the world of communications. I'm in the world of mass media and communications.
Yeah.
And one of the worst things, take away the issues, psychological and emotional for the target. in the
Yeah.
workplace, what ends up happening is you have a chilling effect where people don't talk to each other. They don't present ideas. They're scared to talk. And I can only imagine that's bad enough in the news business, the sports business, which was it
Yeah.
I was in. I can't imagine what it's like when doctors aren't communicating, especially with the senior doctors, because they're scared about the response they're going to get.
Yeah.
I mean,
Yeah.
now you're talking about people's lives at stake. They're not, not talking
Yeah.
about a news story that might not be written as well or something. But
Yeah.
so in your practice, um, because I'm curious what you're doing and how you're counseling the people that you're meeting with, organizations or individuals. Um, I read that you use stress management techniques and mind shifts to build confidence because you said, we lose our self-esteem,
Yeah.
we lose our
Yeah.
confidence, we lose our dignity. So in your practice, how are you addressing those issues for people that are targets of bullying and under extreme stress and trauma?
Yeah, so I think it's important to say that, there are these approaches for the individual, and you have to kind of implement these and utilize these. But at the same time, that is great and it's helping one person at a time, but there has to be a sort of organizational systemic approach as well. I kind of call it a top down and a bottom up approach, both simultaneously, because
Yeah.
you may well be equipping one person with some skills to cope in the future, and let's not forget these are ultimately very, very resilient people. To get through high school, to get the GPA they need to get into medical school, to get through medical school and internship and residency, these are super, super, super resilient people. So when when they are broken, they have experienced it, or they've been on the receiving end of a lot of stuff. So we've got to kind of amalgamate those two approaches. But yeah, I mean, there's the stuff of teaching them how to deal with stuff at the time.
Yeah.
So if it happens to them again, how can they de-escalate situations? How can they depersonalize situations? How can they distract? How can they utilize other people in the group? When the situations that I've had, sometimes there've been upwards of 12, 15 other people around where I have been absolutely screamed at by someone,
Yeah.
including patients. It's happened in front
Yeah.
of patients. Massive levels of unprofessionalism there from the leaders there. But try and bring other people in to kind of cause a distraction, and then ultimately, as I said, with physicians and a lot of other professionals like lawyers, will be the same, that it's very hard for them to admit to themselves that they'll see it as a weakness. They'll perceive it as a weakness. Yeah. So admitting to
Yeah.
yourself that you're being bullied,
Yeah.
accepting it, you can't move forward with anything unless you have acceptance. You'll
Yeah.
know this from your own experience.
Sure.
Um, and I think the thing that I started doing about 4 years ago, just under 4 years ago, was I may have been one of the first physicians, kind of go on record and just give my story openly and authentically.
Yeah.
And we just need more people to do that, because most people are not hearing my voice or coming across my content. So we need more and more and more people to talk about it openly, so that the other people who are targets know they're not alone, and they know
Yeah.
that it's not their fault.
That's that's been the impetus for me to get into this work,
Yeah.
because
Yeah.
I just want to add my voice to those of you who've been fighting the good fight for a while. I want to get back to one thing because you've given up
Yeah.
medicine to help other people
Mm.
through this issue.
Yeah.
I mean, that's how bad the bullying was for you, and you spent so
Yeah.
much time, obviously, and now you're using your medical degree and your law degree to help others in those circumstances who've been bullied. So let
Mm.
me ask
Mm.
this: you talked about top down. In my
Yeah.
experience, uh, I never saw any of my bullies become contrite. I didn't see
Mm.
self-awareness. Now, of course, they didn't come
Yeah.
across you. They didn't seek any kind of help.
No.
And me trying to get them help was, like you said, there was nobody to go to. So let me
Yeah.
ask,
Yeah.
in your work with organizations and working top down, are you seeing any bullies who go, "Oh gosh, I didn't realize the impact that was having"? I mean, is that even possible?
Yes, it is possible because not every, you know, so-called bully or someone who's perceived to be a bully is a, an absolute aggressor, a narcissist, a kind of an evil person. Some of them are, what you might call accidental bullies,
Hmm.
as in they don't have the self-awareness, the insight to realize how they're hurting other people, and
Yeah.
so we know that hurt people,
Yeah. Yeah.
right?
Yeah.
So, and to give them to, some sort of equity in this situation, it's all learned behavior. If they're of a different generation, they have seen their bosses just do that to them
Yeah.
and to other people around them. So that they model themselves on that, thinking that's the right way to be because there's no leadership training at medical school.
Right. And
So,
I don't think business
yeah,
schools either.
yeah,
We're talking
yeah,
about, I mean, the kind of bullying we're talking about, it's astounding that it's happening to doctors, but it's
yeah,
happening to people.
yeah,
And ultimately, it doesn't matter. Like, I moved up from senior producer, executive producer, vice president of programming. And like you said, when I'm a senior doctor, it doesn't matter what your title is. In my view, it doesn't matter how you're compensated, particularly
yeah,
because you
yeah,
want that affirmation. Like you said, you want that, wow, you did an unbelievable job caring for that patient.
yeah,
That was, we all want to feel good about our devotion, our loyalty,
yeah.
and our commitment to the work. And that's where, when we're getting bullying, I think it's so, so very, very painful.
Yeah, yeah. No, so I know I 100% agree. So, I think that they're not all malignant individuals. Some of them are
Yeah.
hurting and they haven't processed, past hurt, childhood trauma. Some of them are insecure people, they'll see you as a threat because you're really good at your job, for example, and it's quite possible that you know more than them,
Yeah.
and they feel threatened by that. But I think for me, the crux of it is that those situations notwithstanding, if they had good emotional intelligence, they wouldn't bully, but
Yeah.
they are lacking self-awareness. They're lacking emotional regulation, the ability to regulate their emotions,
Yeah. And I think those
Um,
of us that are targeted, like, I didn't have the emotional intelligence to figure out how to fight it, how to
mm,
figure out the political battle, how to
yeah,
maneuver, and so all I did was say, I just need to work harder and better
yeah,
and get more views for my TV
yeah.
shows or make more money for the company. And
Or the,
it never worked.
the insight to realize that it wasn't personal.
Yeah.
It wasn't about you. And so,
Yeah.
then when you realize that, when you have that light bulb moment, you can be like, okay, this is why they're doing it because they've got a shit marriage
Yeah.
or they are being disciplined at work for something else, or, they're killing patients accidentally because they're terrible surgeons. And,
Yeah.
whatever the reason is, you can then rationalize it if you have that self-awareness. But you know, the the good news is that emotional intelligence can be learned and
Okay.
developed and worked on, and it is a skill. It's a muscle like any other skill. You can work on it and make it bigger. So you can help those people, um, and that is obviously part of the organizational approach.
Yeah.
But a lot of it, really, for me, I mean, we didn't get the chance to talk much about the individuals. And how to help them. But in terms of organizations, it's really about the culture, isn't it? It's really about the values in an organization. And this comes from the top down.
Yep.
And organizational values have to be genuine. They can't just be, these are our values on our website, but actually on the shop floor, this is
Yeah.
what's going on. There has to be absolute alignment between what they're publicizing their values as being
Yeah.
and what they really are. And they need to bring people into senior positions who are in alignment with those good values to develop and promote positive cultures, and we need more compassion in the workplace. We need compassionate leadership, servant leadership, inclusive leadership. We need workplaces where we almost have like a United Nations right to be happy at work, for that to be for it that, I mean, that may be a bit twee, but
No, I agree.
at the least it has to be normalized that we have a right to go through our day without being, kind of
Abused.
treated in a rude,
Yeah.
uncivil way,
Especially, I mean, it's one thing if you show up to work drunk, you show up late,
yeah,
you don't do your work, but we're talking about
yeah,
really good employees here. So
yeah,
I have a couple minutes remaining, and I want to ask you
yeah.
this because you're one of the leading worldwide voices in this arena. And so that's why I'm so pleased to talk with you and so appreciative of the work you're doing. Uh, what do you think uh, is the current circumstance around the world in terms of workplace incivility? Is it worsening? You're in New Zealand. I'm in the United States. It still seems to be an epidemic to me, but you've got a world view. What's your
Yeah.
sense of where we're going with this issue?
Well, yeah, I mean, I'm British, and I live, kind of 48 years of my life or whatever in the UK. We only moved to New Zealand 8 months ago.
Okay.
But I've lived in Australia as well, and I've worked with an awful lot of American physicians and some Canadians as well. So I can only really speak in with authority about the sort of English speaking countries. I
Okay.
mean, I do have some contacts in Europe and Asia, but and the things are there are cultural nuances, but it is, I think, the pandemic really shone a light on it. And I think by the time, we were all kind of starting to get hassle for, working from home and being bullied remotely and all of this, I think a lot of people were saying enough is enough. So I think more people seem to be willing to speak about it. There is a movement, I would say, and I think that's really, in no small part, been sort of championed by Linda Crockett, who founded the Canadian Institute of Workplace Violence and Harassment.
Yep.
Uh,
Linda's taking part in this summit. Yep.
yeah, I mean, Gary and Ruth Namey, created the Workplace Bullying Institute in the USA, so that's the preeminent place.
Yep. They're terrific.
But I mean, Linda has really kind of created this network of us from all around the world.
Yep.
Um, and I don't know whether the data shows that things are getting worse or whether it's just more people feel more comfortable about speaking up now.
Yeah.
Is probably what it is. I think it's always been pretty horrendous.
Yeah.
I think the pandemic made it worse, but the
Yeah.
flip side is that, now the conversations are beginning to happen. And,
Yeah.
someone like yourself maybe wouldn't have done this 5 years ago,
Not a chance. I
but
mean,
now you feel,
yeah.
comfortable doing it.
Well, I would say I would just amend that and say I'm a little uncomfortable, but
Okay.
people like you who are making me feel more comfortable that I can share this story. I'm still dealing with my shame, a little bit of anger still, trying to figure it all out. But because of people like you, I want to add my voice and see what I can do to help this movement. So, Dr. Adam Harrison, I want to thank you so much for what an engaging and informative conversation and for all the great work you're doing. And for those people watching and listening to this, how can people contact you for more of the advice and counsel that you've shared with us today?
Yeah, no, thank you. Thanks, Andy. And I'm happy to kind of go into more detail in how I help people if they want to approach me directly. My email address is just doctor, so dr.adamharrison@gmail.com. So dr.adamharrison@gmail.com, all lowercase. My website is www.dradamharrison. It looks like Dradam Harrison. Someone said to me once, because there's no full stops in there.
Yeah.
I'm on LinkedIn as Dr. Adam Harrison. And my podcast is really championing female leaders, because throughout my career, I felt, although there were some good male bosses that I had, and there were a handful of bad female bosses that I had, on the whole and in the main, my female leaders were more enlightened, shall we say, and kinder and more inspiring. So my podcast is called Inspiring Women Leaders, and we talk a lot about the things that I think are important, compassionate leadership, servant leadership, inclusive leadership, and kindness in the workplace, and the benefits, the far-reaching benefits of kindness to individuals, to teams, to bosses, to the organization as a whole, to shareholders, to third-party stakeholders. It's just a ripple effect. It's a gift that keeps on giving, and to me, kindness in the workplace and civility in the workplace plays a big part in being the antidote to these toxic cultures.
Yep. Toxic cultures are counterproductive in every way. Final word from me. We call ourselves bully targets, but now let's aim to change the workplace for good. Thanks for watching.